Good day, viewers. Welcome to a new edition of 30 Minutes, the interactive program of Trust Television, with me, Manir Dan Ali. Our guest today is a freshly minted fellow of the Nigerian Academy of Science, the Pro-Chancellor of the Aliko Dangote University of Science and Technology in Wudil, Kano State, Professor of Public Health, Director at one time of the Infectious Diseases Research Section of Zubairu University, Kano. I'm talking about Professor Zubairu Ilyasu. Professor, welcome to 30 Minutes.
Thank you very much. Just a little correction. Former Pro-Chancellor.
Good.
And the center is Center for Infectious Disease Research of Zubairu University, Kano.
Exactly. But you are equally aligned with the Aminu Kano Teaching Hospital.
Yes, I'm a consultant public health physician with Aminu Kano Teaching Hospital.
You wear so many hats. I've met you at some committee that also deals with the immunization to do with polio, which you do for Nigeria and also for the African continent.
That's right. I also chair the National Certification Committee on polio for Nigeria, and I represent Nigeria whenever there is a meeting of the African Regional Certification Commission for polio, like what happened last week in Benin Republic.
Right. Let's talk more broadly first about public health. One of the big issues, especially in northern Nigeria, is this issue of kidneys going bad. You see a lot of even young people, middle-aged people, elderly people with this ailment. I don't know, even if it may not be your own area of specialization, but you must be familiar with this big issue. What is the scientific or medical community doing in order to get to the bottom of why the high prevalence, especially in that Kamadugu-Yobe Valley from Borno State down to Hadeja in Jigawa State?
Yes, though I'm not a specialist nephrologist and have not conducted a lot of research in the area of renal diseases or kidney diseases, but I'm aware of the high burden of kidney-related diseases, particularly around Hadeja in Jigawa State, and as you mentioned, extending to Yobe and so on. I have not come across the results of research related to the main causes of that, but one can suspect that heavy metal poisoning may explain some of the high burden of kidney disease in that area, and it may probably have to do with some other chemicals or heavy metals, probably in the water supply, but really we need focused research to get to the bottom of this.
Is this something that's got to do with maybe mining, illegal mining, or is it possible that there may be these heavy metals in the water sources that the communities in the areas affected are using?
These are all possibilities, but like I said, to get to the root of the matter, I think focused research needs to be done in those areas with high burden of kidney diseases. And as you know, kidney disease is a very expensive disease. No matter how comfortable or rich you are, once afflicted with end-stage kidney renal failure, then you will be on dialysis, which is very expensive despite all the efforts that government is putting in and some philanthropists putting in providing dialysis. It's kidney transplant that is the solution to that. But
even that, it doesn't come cheap.
No.
And then you have to match the donor, you have to take some anti-rejection drugs and what have you.
Prevention is the key.
Which suggests that we should hurry to find the source.
Definitely.
What is the cause of this heavy prevalence? Because increasingly you find that more and more people are getting afflicted with the problem.
That's right. And you mentioned the difficulty of even the temporary relief of, let's say, having to transplant kidneys. You know how much that will cost, and then identifying compatible donors, it's an issue. And more recently, of course, you know the scandal of having to recruit young people and giving them pittance and then removing their kidneys, and with very severe consequences, because you don't even know the status of the two kidneys that you have. You probably will even give the good kidney and leave yourself with one
that is
exactly.
impaired.
And that can be really terrible. So it's really the prevention is the key, I tell you.
But in the Nigerian health architecture, which level of government should be dealing with this matter? Is it the federal government, the state government, or how do you get to grips with it?
No, it's all levels, starting from primary healthcare to secondary healthcare and then tertiary healthcare, which, of course, we know primary healthcare is the responsibility of local governments.
But local governments are more or less dead in Nigeria.
Well, yeah, you can say that, but unfortunately, local governments are the closest to the people. They are the closest to the people, and they are the ones that, if the local government areas were, local government councils, if they were active, and even little funds sent to them can have serious impact, because at the primary healthcare level, the emphasis is on prevention. And you know what we can get from prevention, even from little money, if it can trickle down to the local government level. There's, at the secondary level, the general hospitals are the responsibilities of the state governments, and then the teaching hospitals are the responsibilities of the federal government.
But who is to do research? Which levels of the government?
All of them, but mainly at the tertiary level. Because institutions like the universities and the teaching hospitals, their responsibilities include, apart from, like the teaching hospital, apart from providing services to the people, training is their responsibility, and carrying out research into issues related to what you just mentioned. It's the responsibility, main responsibility of teaching hospitals. And you know teaching hospitals and the universities, they work together.
So, like Aminu Kano Teaching Hospital, which you are associated with, is it carrying out any research? Is it, to your knowledge, is there any concern? Because I know that it's also one of the centers where some dialysis happen.
Yeah.
So, is it also involved in researching to find out the culprit in this high prevalence of the disease?
Definitely. I know Professor Aliu Abdu, who heads the nephrology section of Aminu Kano Teaching Hospital. They've been engaging in a lot of research to find out this. In fact, I think probably the last time I heard about the issue related to Nguru, Yobe, and regarding kidney disease, I probably think it must be a discussion between me and Professor Aliu Abdu. And in fact, Aminu Kano Teaching Hospital, together with Zubairu University, in recent times, the trust in carrying out research in those institutions is in collaboration with, for instance, the Vanderbilt University in the US and several other universities abroad. They've done so much. That's why the ranking of Zubairu University has been always in the top, at least 5 of Nigerian universities. Compare that with 20, 30 years ago. So a lot of research is going on in Aminu Kano Teaching Hospital and Zubairu University, Kano, I assure you.
But some of the research tends to be controversial. I mean, not necessarily with the university like the Pfizer one. You remember all the controversy about the surreptitious, if you may put it way, in which the company came and administered some maybe probably not too certified injections on people who ended up getting paralyzed.
Yeah, sadly.
And I know you are also concerned about ethics in medicine.
Yeah, you know, sadly, that event happened. It was early days, really. I mean, one is not trying to defend what happened at that time, But I think it was the stage of institutional development and the lack of emphasis on ethics in research. And I probably think deep within myself, I was appointed chair of the National Health Research Ethics Committee in February 2017 by the former Minister of Health. And deep within myself, when I sit and reflect, I was thinking probably one of the reasons why that position was pushed to Kano, to northern Nigeria and to Kano, probably is because of that problem that we had with Pfizer. So it was giving us an opportunity in the north to develop research ethics to the level, to the very best level, not only locally, but internationally, so that participants in research are well protected. What happened with the Pfizer research can never happen now, because the Federal Ministry of Health has developed the ethics committee and structures in such a way that you cannot just go on and carry out that type of research that happened in the 90s. It won't happen now.
So we passed that stage as far as
we have. We have.
What about in other areas? I mean, we've talked of the kidney, then this one to do with polio, which eventually caused so much problems. And Nigeria was certified as having exited the polio club, maybe is it 6-7 years ago? But here we are, your committee is still meeting and trying to see how do you completely get rid of that problem, because there is still the mutant, the one that is supposed to have changed because of the vaccine that was administered to children.
You know, the issue is as you solve one problem and you want to relax a bit, nature has a way of keeping you busy. You know, so there is what is called the circulating variant of poliovirus, particularly type 2. You know, after declaring us free of wild poliovirus, then it started coming up. And it also leads to paralysis. You know, the parents does not want to hear from you that, oh, this one is due to a circulating variant. Once the child is paralyzed, the child is sick. And so you need to do something about that. So that's why the world is worried. Excellent, we've met efforts while poliovirus is no longer here, but the circulating variant, because it can also lead to paralysis, that is why we have now focused on that. And sadly, again, initially, you know, for the wild poliovirus, the toughest battle we had was in the northeast, mainly due to insecurity from the Boko Haram and all that
saga.
But now the circulating variant of poliovirus type 2 is cornered in the northwest.
So it spreads also to that part because of the ungoverned spaces.
Exactly. A different type of insecurity. So some of the lessons that we learned in the northeast, we had to modify them to fit the type of insecurity, banditry, kidnapping that goes on in the northwest. But there is some hope, because, for instance, in Zamfara, for the past 6 months, there are no reported cases of circulating variant poliovirus type 2.
Is it because truly there are no cases, or there are no reported cases as per your record?
I tell you, if there is anything that I'm very confident in the health system, it's the surveillance system. The surveillance system, in fact, the reach of the surveillance system, if we were able to reach children with vaccination to the extent that we are able to reach with surveillance, I think we will have solved a lot of problems. So I am very positive, because there is what we call community informants in inaccessible areas. These are people that are resident in those areas, but whenever parents notice paralysis, they inform them, and you know, steps are taken to address such issue. So the surveillance reach in the northwest Zamfara, Sokoto, Kebbi, Katsina, despite the insecurity, the surveillance reaches is quite commendable. So I positively think it's real. It's not a fluke. It's not because we are unable to reach people for surveillance.
Very interesting point there, and we'll come back to it when we come back from this short break. Viewers, it is 30 Minutes, the interactive program of Trust Television, and our guest today is a professor of public health, Professor Zubairu Ilyasu.
This is Trust TV, documenting the Nigerian story.
Welcome back. It is still 30 Minutes, the interactive program of Trust Television, and our guest today is Professor Zubairu Ilyasu, a professor of public health and a member of so many committees that deal with immunity, that deal with fighting polio virus and other such cases. Professor, if you could take us back, we are just mentioning about your confidence in the surveillance system. How confident are you with the actual application of the polio vaccine to children, some of whom are too young to say whether they've been given or not given, and then a system that is somewhere corrupted where some people may not necessarily administer it to real people and then come back and just fill in records?
Sadly, I'm not so confident about the vaccination. That is not to take away the very good efforts that most of our vaccinators and the teams in the field, under difficult circumstances, are trying to ensure that our children are vaccinated. But of course, in most things in life, there are members of vaccination teams that probably that we don't trust that what they report to us is what they really do in the field. Because if you recall, in our meeting, there was the mention of fake finger marking. I mean, which one is easier? Is it dropping the vaccine in the mouth of the child or going to look for a pen that will look like, a marker that will look like the one that is used so that you will fake it on your child? Which parent will want to be dishonest to this level? Which parent will do this?
Well, but you know that there have been all the concerns about the vaccinations. And to this day, there are people who say, why are you so fixated on polio while malaria is our problem or something else is our problem? You know, a lot of the local people cannot understand that.
Yeah, that's right. I understand their concern and the logic that they are using. Unfortunately, you know, in life, these diseases come with different causative agents and the behavior of causative agents and what the technologies that are available to the health system to fight this. Some diseases lend themselves to the possibility of eradication, you know, and once a decision has been made to eradicate a certain disease, these decisions are not made only at national level. The decisions are made at global level, and Nigeria cannot just exclude itself and say, oh, let's focus on this disease and that disease. Scientific evidence is presented at the global level, and countries agree on which diseases to target based on the evidence that these diseases can be eradicated. How I wish the other diseases that our people have felt need for are also easily, we can also easily eradicate them.
Like malaria, for example,
malaria,
which is one that
a lot of
people experience multiple times.
If you look at it historically, the world has struggled and tried, even during pre-colonial times, because when the white man wanted to visit us here, malaria was a major challenge. So they had tried this, and even at the global level, that has been tried to little success, you know. But there are what will you use? Low-hanging fruits, you know. So those diseases that we see that technology is available and the efforts that are required to eradicate them are relatively easier and also more cost-effective. That's why the world focuses on certain diseases that may not make sense to somebody who is hungry and say, why not convert the money that you are spending on polio to buy food and distribute to people? I understand
yeah, people
that.
have that kind of...
I understand that, but you see, these programs are evidence-based, and it's not everyone that will understand that.
So are you hopeful that we will reach that day, in spite of some of the peculiarities in our environment, open defecation, what have you, will reach that day when, I mean, even this variant of the polio virus will be eliminated?
Oh, yes. Oh, yes.
I know there is also supposed to be a target. Is it December of?
The target is December of this year, December 2024. As you may recall, during our discussions in the meeting that we just concluded, since we were able to push the wild polio virus out, I think if we get the cooperation of the government and the people and communities, traditional and religious leaders, you know, I think even at less effort than what we did to be certified wild polio free, I think we can push out the circulating variant of poliovirus type 2. If not by December this year, maybe next year.
You also did some, or are doing some research related to HIV and what have you. Where are we on that dreaded ailment? Because now it's been more or less normalized. People treat it like malaria, and people are not as fearful as in the early days when they assume it's just a death sentence.
No, HIV is still a very serious matter, I tell you. Though, of course, advances have been made where the disease with medication, and not only medication, with adherence to medication, and also taking steps to prevent the acquisition or transmission of the disease to others, starting with mother to child, you know, transmission, and then, of course, the major route of transmission through sexual intercourse and all of that. I think the government and international partners have put in a lot of effort to address the issue of HIV. But I tell you, HIV is still an issue, and do not take that disease lightly, and the treatment is lifelong. But
like, people can survive, and people take their medication seriously, and there is, I mean, ready availability of a lot of the medications, unlike in the past when it was maybe difficult to access.
Oh, yes. You remember the time that those that had HIV had to buy the drugs, very expensive and all of that. But now with the help of government and partners, these drugs are readily available. But like I said, make no mistake, it's not easy to be taking a drug every day throughout life and all that. And the stigma has also reduced,
kind of
and the discrimination and all that. So I think some good efforts, not only from government and partners, but for among those that are living with the virus, you know. We've done researches. In fact, the last one that we did, we are trying to see how it will work, providing the opportunity for telemedicine or teleconsultation for patients living with
do not
HIV.
have to go
they don't
to
necessarily
hospitals,
you know,
from their phones.
That can also increase the interval that they need to visit the hospital.
Yes.
Initially, of course, for initial assessment, you have to come, but for follow-up, you know, and when you travel and all that, over the phone you can get instructions and continue with your medication. So we are doing that in Aminu Kano Teaching Hospital, the research, yes.
What about training of doctors? We saw recently that the Nigerian authorities have asked all the medical schools to just double their intake. I know more people than even the doubled number want to do medicine. There are limited spaces. Can the universities cope with this overnight decision, just double the intake?
How I wish that overnight decision also comes with increasing the number of lecturers in those medical schools, expanding facilities and buildings, modernizing, providing technology that will help in instruction and all that. I think with that, we have capacity, really. And don't forget motivating those that have not jackpot. The
exactly,
that have
there
not
is
jackpot.
This problem of Japan that's
motivate
leaving
them.
Nigeria for greener pastures.
Because if a lecturer is teaching 60 students in a class and then he suddenly comes to see 120 students in the class and his situation is earning,
is the
and
same.
working condition is the same. He will not be motivated. But it's not about capacity of Nigerian lecturers to put in their best to produce. We can really produce more. But if we are supported with well-motivated lecturers, improve their conditions, expand the facilities in terms of equipment, buildings, technology, we can increase the capacity of the training institutions to produce more.
So as it is, there is an existing manpower. Are you suggesting within the university system to cope with this?
No, I'm saying that we need to recruit more and motivate, and motivate them so that they don't japa, so that they stay in our universities, and then working together with the ones that are currently in the university who should also be better motivated, by improving their condition of service, then we can deliver more.
A bit of a tall order, but it doesn't mean that it's impossible.
Yeah.
Professor Zubairu Ilyasu, thank you very much for giving time to this program.
You're welcome. Thank you. My pleasure.
And congratulations on being a fellow of the Academy of Sciences.
Thank you. Thank you very much. I am really honored. Thank you.
Viewers, that's the end of this edition of 30 Minutes. Keep a date with us.